When it comes to good health, doctors, nurses, and professionals in the health sector are the go-to persons for prescriptions, medications, and surgeries. But it becomes difficult when there are loopholes such as quackery in the sector, when unqualified persons are the ones administering those medications. Adebola Akin Bright, the 12-year-old boy whose small intestines were found missing after being treated in a small private hospital, is one that fell into the wrong hands. Also, the case of Mohbad, the 27-year-old artist who mysteriously died after an unregistered nurse gave him injection, is another case. These are just cases that many hear about because it got to social media. How about those unheard? And that's the truth. Many cases have gone on without being reported, but just these two have brought to the fore the challenge we are facing as a country, where we have gaps. As it is now, it is being reported, the United Nations had given a specified number of doctors to patient ratio, but right now we have overshot that ratio as it stands. We hear that it's about over thousands of patients to a particular doctor because of the brain drain in that sector as it is right now. And then we are beginning to see persons trying to fill in the gap, because in life, in nature, you cannot have a vacuum. People have to see how they fill that vacuum one way or the other. Unfortunately, people are falling victims of quackery as it is. And also the matter of out-of-pocket treatment being not affordable for a majority of persons, they also find themselves falling into the hands of quackery persons who are quacks as it is. And then there's also the aspect of education, understanding what it is that is required for any person who is set to be a professional to do. Because for the case of Akin Bright, it is reported that the surgeon, in quote, is actually not a qualified surgeon. And so he did not do the necessary test. All he did was to open up the boy, cut off his intestine, dispersed it in the wrong way, because once you do surgery, you are supposed to take that as a sample, whatever you took out as a sample, to a lab to check what exactly is going on in the system so that they can do further investigation, but that did not happen. So it's just a really sad case that we had to have two persons with bright future cut off like that.
Well, you really said it all, and it's so sad, the level of healthcare system that we have in Nigeria, and it's so sad, worse off for people to not trust the medical practitioners, and this is something that is really very sad. I feel the government needs to get on top of this situation, and because Nigerians really are supposed to be well taken care of in terms of, okay, not only you working on the economy, not only because health is wealth, they say. It's one of the key things that the government has to do for the Nigerian people. I must give it to the governor of Borno State, Babagana Zulum, pumping money, doing a lot of projects in terms of infrastructure, the healthcare infrastructure, and all of the things. In fact, it became the best states in the country for medical, from primary healthcare. So I feel all other governors need to look into, how do we shore up and make better healthcare system for the people. The issue of Akin Bright that you said, so sad, we still are condoling with the family. But another doctor had a different opinion. He said the problem there was not that the surgeon wasn't qualified, but because it was maybe there was miscommunication. Because what could have happened to the guy, to the boy, was the fact that normally when you have a part of the intestine inflamed, and the other one is also bad, and it takes about 6 hours for it to rot. So it has to be cut off, from either side, and then they join it together. So, some other medical practitioners analyzed it. So in all of this, I feel
there was a statement that came out on Friday saying that the doctor that undertook this surgery was not a qualified surgeon.
Yeah.
So that statement does came up.
I get you.
Yeah.
I get you. I'm saying that what other people, that's an investigation, and other people are saying not only maybe whether qualified or not, but the fact that they should also learn to communicate properly, because we don't understand when you use a medical term, we don't understand exactly what they are saying. They have to always use better communication. So that's on that side. The issue of Mohbad as well, the nurse that injected the guy, giving him, what was it called, antitetanus or something.
Because of an infection.
They said the nurse too was not professional, that she's not even a nurse. She was denied by the association that she's not a member of them. So, whether auxiliary nurse, whether someone who is just, helping out in the hospital, and then they come out, and everyone, as long as you're wearing that dress, we always assume that you are qualified and all of that. So I feel a lot needs to be done. Much regulations need to be introduced, and enforcement of some of the laws that are already, promulgated. So in all, the federal government, the governments at all levels, local governments, up down to the local councillors, they should work on ensuring or improving the primary healthcare service to the people, so that ordinary man who does not have enough to go to, to the hospital will have all of these things subsidized or even administered for free.
Absolutely. These are critical issues. I recall the past administration saying that they were going to look into addressing this matter of primary health care, bringing about 10,000 of them, reviving them as it is, but not much was done with regards to that. And this is that basics with regards to healthcare services delivery in the country. This is where it begins from. And if that is broken, in terms of the state which it is in now, how the other level of healthcare delivery will feel the burden, will be at the burden of all of it as it is. Because for someone like Mohbad, perhaps if there was a functional primary healthcare center around him, maybe he could have stepped in there to say, this is what these are the issues, because they deal with all of these basic issues at that level.
And I think we need to imbibe the culture of going to the hospital. If you are having issues, maybe stomach ache, or you're having some sort of symptoms or signs, it's better to go seek medical attention rather than just give yourself
go over-the-counter treatment.
Exactly.
Or saying that, oh, this is a regular thing we do and we know how to handle it and address it. Look for the right persons who are qualified to addressing it, because right now these lives has been cut short.
That's right.
That's a sad one. And then these hospitals that have been identified to have carried out, quackery, so to speak, to have persons who are not qualified, the state government has to look at shutting them down as it is.
Completely.
So as to bring them to book, because lives have been lost as it is, and we do not know how many more have been lost in the process. So investigations have to go on to addressing all of these issues. We'll leave the conversation here now.